After your joint replacement, you will be admitted to the orthopaedic ward and looked after by the ward team. Nursing staff will help you with your medications and remove any attachments you may have after your operation. Please tell your nurse if you have any nausea or high levels of pain. To begin with, nursing staff will also help you with your personal hygiene, but will then encourage you to do more by yourself. After your surgery, you will need an X-ray and blood tests will be taken. It is normal to feel some pain after surgery, but it will be different to the type of pain you felt in your joint prior to surgery. Giving your nurse an accurate description of your pain will allow them to figure out the best way to manage the pain. It will allow you to move around and actively participate in therapy, exercises, and personal hygiene. Regular pain medication is needed by everyone after surgery, so please don't worry about asking for medicine if you need it. We recommend taking pain medication 45 minutes before you do activities such as showering, walking, and exercises. Ice and distractions such as TV, visitors, and music can also help reduce pain. Pain will improve each day, however, you can expect some discomfort for about 6 weeks after surgery. You will be given a script for pain medication when you go home, and your GP will also be able to help with pain relief once you're home.
Surgical procedures, including hip or knee replacement surgery, could increase the risk of clots forming in your blood vessels. Reduced mobility following surgery can also add to this risk. It is important to tell your pre-admission team about all your medical conditions and any medicines you are using so that your risk of developing a blood clot can be properly assessed. Your surgeon may commence you on a blood thinning medication, if appropriate, after your hip or knee replacement surgery to reduce this risk. The blood thinning medication may be in the form of an injection under the skin or an oral tablet. Please let your pre-admission team know if you or a family member would be unable to administer injections. When you are ready to discharge home, you'll be advised on how long to continue your blood thinning medication and any potential signs of bleeding you should watch out for.
You'll recover better in your home environment than if you stay in hospital and will be at less risk of getting an infection. You may be worried about going home, but remember, the team caring for you are experts and will only send you home when you have been assessed as ready. Nursing and medical staff will keep an eye on your wound to make sure it is healing well. We usually remove staples 2 weeks after your surgery, so you will likely go home with the staples still in. We will organise for you to have the staples removed by one of our team or by your GP. Complications after surgery are rare. However, you should go to the emergency department to be checked by the orthopaedic team if you have any of the following symptoms in the weeks after your surgery: a temperature higher than 39 degrees Celsius, continued discharge at the wound site, heavy bleeding from the wound site, or if you can see pus on or around the wound, redness around the wound that is spreading, swelling, warmth or pain in the calf or ankle of either leg, sweating, shivering or chills, if you feel unable to catch your breath or if you have breathing difficulties, strong pain or tenderness that doesn't improve when you take your pain medication. If you have any other concerns, please don't hesitate to get in contact with your GP, the rehabilitation team, or call us on the number provided on your hospital discharge summary.
The physiotherapy team will teach you exercises to do at your home before you leave hospital. When you're exercising at home, follow the instructions for taking pain relief so that you can do these exercises as comfortably as possible. Most people will be referred to an ongoing home-based rehabilitation. This means that initially a nurse and a physiotherapist will come and assess you in your home, give you exercises, and keep your mobility progressing. After that, you'll be able to come into the rehabilitation centres for your sessions, which will usually be in the form of group classes or, if suitable, online group classes. Your therapist will talk to you about which is most suitable for you once you have reached that stage. You may need to use a walking aid or crutches for 3 to 6 weeks following your surgery. Most people return to their daily activities within 6 to 12 weeks after surgery, although every patient is different.
People often ask when they can start driving after surgery. You may not be covered by insurance if you drive during the first 6 weeks after your surgery. For this reason, we recommend that you do not drive this time. unless your doctor has given you medical clearance. People also ask when they can return to work. The time that you will need to take off will depend on what you do for your job. You may be able to get back to a desk job in 3 to 4 weeks. A more physical job may take up to 12 weeks, depending on what you need to do. Your rehabilitation team and your DP will be able to guide you.